The vitamin D and omega-3 trial, VITAL, is a large-scale randomized trial of vitamin D and the marine omega-3 fatty acids in the primary prevention of cardiovascular disease and cancer. It's a large nationwide cohort of men and women 50 years and older. This is a primary prevention trial in men and women without a history of cardiovascular disease and cancer. It's a usual risk study population that is age 50 and older and racially ethnically diverse. We have over 5,100 African Americans in the trial. Many people in the general public are taking these supplements already. It's about 10% of adults are taking fish oil, and at least 20% are taking a relatively high dose of vitamin D, more than the recommended dietary allowance. And if you include multivitamins or some form of supplemental vitamin D, it's well over 1/3, close to 40% of the adult population. So these are widely consumed popular supplements. There's a lot of interest whether people should be taking these supplements or should start taking these supplements for the prevention of cardiovascular disease and cancer. Our message at this point is that if you're already taking these supplements, we don't have signals from this trial to suggest you should automatically stop taking them. We're not seeing a lot of risks. However, we do caution patients, and we caution clinicians as well that this doesn't mean megadoses of these supplements will have the same safety profiles. So, for example, very high doses of vitamin D have been linked to hypercalcemia. Very high doses of omega-3s may increase risk of bleeding. So at these doses, it was relatively safe over the 5.3 years of the trial, and we don't think there's an urgent need to stop for those taking them. However, we're not recommending that everyone begin taking these supplements. For those who have low fish intake, even though we encourage getting these nutrients from the diet, and we certainly encourage fish intake because it can replace red meat and saturated fat and processed foods, some people do not eat fish. And in that situation, we do think that some patients may be candidates for fish oil supplement. It has to be done on an individual basis. They have very, very low fish intake or no fish intake, and they have multiple risk factors for cardiovascular disease. They may be a candidate for starting a fish oil supplement, but we leave this to the clinicians to decide on an individual basis. And we hope that over the next couple years, between the VITAL trial and other new trials that will be reported, that there may be some revisiting of the clinical guidelines about the use of these supplements. Whether it's to say very definitively that they should not be used, or to define populations of patients where the benefits seem to outweigh the risks.